So you guys want to hear something absolutely insane? When I first started offering aligners to my patients, I produced over $250,000 in just 6 months exclusively in aligner treatment. This is a graph showing exactly what my numbers looked like when I started. Basically, I started over 50 cases in just 6 months, and all that amounted to over $500,000 in 18 months simply with aligners alone. That highlighted area that you guys can see right there, those are the real numbers that I produce. And the reason why I'm showing you guys all this is to show you that it actually works, okay? Because if I could do this, so can you. But it wasn't always like this. When I started, I didn't know how to do much dentistry, let alone do it profitably. And I was always struggling to figure out the best use of my time. I wanted to know what procedure I should focus on. How can I help the most patients while making the most money, spending the least amount of time in the chair? Those were the core things that I wanted to focus on. And so I spent over 1,000 hours. I tried several strategies and I watched countless webinars to try to figure this out. And I found out more ways on how to do several procedures the wrong way before I figured out that aligners were the most profitable procedure that I could be offering as a dentist. And so I'm gonna save you the 1,000 hours and all the battle scars and just tell you why aligners are the most profitable procedure in dentistry. So there's 4 key reasons that make it one of the most profitable dental procedures that you can offer if done correctly. So the 4 key reasons: 1, there's increased demand, there's decreased supply, it's a high ticket procedure, and there's minimal chair time involved. So for this training, I want you to know that it can work with all the brands, okay? This is completely brand agnostic. So whether you're using SureSmile, Candid, Invisalign, Spark, OrthoFX, ClearCorrect, it doesn't matter. Take whatever brand you're using and apply the concepts that I'm gonna show you in this training so that way you can have as much success as possible. So one of the reasons is due to the current imbalance between supply and demand. And now if you're watching this, chances are you are a dentist or you are about to be a dentist. And so you probably didn't do too well in economics. So I am going to just break this down real quick regarding supply and demand. So when you take supply and demand and you relate it to the aligner market, the supply is the number of dentists who are offering aligners, and the demand is the number of patients who want it. So when the demand goes up and the supply goes down, prices go up. And when demand goes down, but the supply is high, prices go down, okay? Uber does a great job of showing this in effect. So maybe you've experienced surge pricing, right? So surge pricing is when you're in an area where there's a lot of riders, but not enough drivers. And so in this case, the supply is low and the demand is high. So what happens? Prices go up for that time period, right? Similar situation for aligners right now. The demand is at an all-time high. Companies like Align have poured in hundreds of millions of dollars into marketing over the last 10 years or so to educate the public on the benefits of plastic trays moving teeth. Companies like Smile Direct Club have come and gone, also pumping in millions of dollars into marketing. Now, they have abandoned millions of patients in the middle of treatment. And simply put, people not only need this treatment, guys, they want it. And so for reference here, there's 300 million prospective patients out there, and there were only 1 million aligner starts in 2023. That is insane. That means there's 299 million patients that need and want this treatment. The thing is you don't even have to spend a dime on marketing to attract any of these patients because they're already in your practice, right? Align and Smile Direct Club have both already marketed to them. So you don't have to do anything. You just need to open your eyes and mouth and start talking to patients who are qualified for treatment because they're sitting in your practice waiting for you to do so. So I didn't talk about aligners with patients when I first started. I'll be honest. I actively avoided it when they asked me about it. And it came from a place of just not being confident, right? I was scared. And so a story about this is one time there was a patient and I was doing an exam on them when they were with hygiene, and they asked me, they're like, "Hey doc, I've got, some crowding here. I would really love to straighten my teeth. I used to have braces and then I actually stopped wearing my retainer. And I think my teeth have shifted." Like, this is what the patient's telling me, right? And so I looked at them and I'm like, "Yeah, well, I think we can fix this. I'm not too sure, but how about we do this? How about we do a scan? I will run it through the treatment simulator that I have. I'll kind of put together a plan and then we'll bring you back for like a half-hour consult. And then we can just talk about whether or not this will work for you." And I did that and the patient was like, "Okay, sounds good." And that patient actually never came back. It's not rocket science and it doesn't take a genius to figure out that it was very clear that that I had no idea what I was doing, which is why I decided to have this patient jump through all these hoops just to come back to find out whether or not I could do the treatment, right? So that's where I went wrong. If I had the confidence to be able to tell the patient, hey, you know what? We can do this in about 6 to 8 months. How would you like to get started today? That patient probably would have said yes to treatment, because that's what confident dentists do. But I wasn't confident. You see, the thing is you guys need to start talking about aligners every single day, right? It's a very simple thing to do, and it can lead to a lot of case starts. The demand itself for aligners is at an all-time high. And guess what? The supply is nowhere near the demand. So a couple of reasons play into that. So one, aligners is not something that's taught in dental school, right? Most dentists come out, they have zero education on it. And like any dentist, if you don't know how to do something well, you're not going to talk about it because you don't have confidence. And then you have the ones who go on and get some basic level training like the Invisalign certification program. And I'm not here to badmouth anybody, but I have spoken with a lot of dentists, and a lot of them say that when they take this program, they walk away not really knowing much about the treatment. They say it's a great marketing tool for Invisalign to use to help familiarize doctors with their platform, but they don't feel confident actually doing aligner therapy. So what does this add up to? About 200,000 dentists in America, with 12,000 of them doing about 1 to 2 cases a month, and only 3,000 of them are doing 10 or more cases a month. Simply put, if you start doing aligners and learn to do it in a profitable way, you can have a leg up on 197,000 dentists out there who are doing it all wrong. And so staying on topic of profitability and money, this is the list of the average price of dental procedures. So aligners are classified as what we would call a high ticket procedure because of the price that you can charge patients. And now they're profitable because you can charge anywhere from $4,000 to $7,000. And if you take in that average of, let's say, $5,500 a case, that is over 5 times the amount of the average dental procedure that you are currently offering to your patients. So imagine just doing 2 or 3 cases a month on top of what you're already doing. That'd be pretty nice, right? And so this is the biggest benefit of aligners in my opinion. It's the fact that there is little to no doctor chair time with the procedure when you're doing it the right way. And you do this by leveraging strategic scheduling to maximize efficiency. And so what you have to have is a proven system to capitalize on same-day starts, delegate as much as possible to your team, and follow the 6-month in, 6-month out protocol. And so strategic scheduling to maximize efficiency, what does that look like? So you need to have a clear system with your team when scheduling patients. I'll walk you through this. When I was doing aligners, there were situations where attachments would fall off. Team would come running to me and they would say, "Doc, what do we do? The patient's attachment fell off." And at the time, I didn't really have a system. And so we would bring the patients in, we'd sit them down, block off like an hour or so. I would look at them, I would kind of see which attachments came off, and then I would go onto the website and I would try to order a replacement. And then I look at the patient and I'd say, "Hey, okay, so I'm gonna need you to just stay in this tray and then come back in about 5 days, maybe a week, and then we will put the new attachment on for you," because I had to order a template for them. This was pretty annoying for the patient, to say the least, because they came in and they left with nothing, right? And so the workaround here is having a system in place for how you're going to schedule patients when things like attachments fall off is super important. Speaking of systems, when you have one that can capitalize on same-day starts, you are going to be extremely profitable with aligners. The main reason is because you're not going to waste chair time bringing the patient back for extra appointments. When I first started with aligners, the first thing that I always did was I would see patients in hygiene, and then I would have them come back for an aligner consult. And so this would be another 20-30 minute appointment to where we would just start talking about the procedure. This was a complete waste of time because the entire conversation can actually happen in a couple minutes and should have been happening in the hygiene chair. And when we made the switch to going from talking about the treatment in the hygiene chair and not bringing patients back for a consult, we ended up getting so many more case acceptances because the patient was so motivated to do the treatment that day. This in turn helped profitability because we didn't have to waste chair time bringing the patient back for extra appointments. I know I've been sharing a lot of situations on how you can systemize things, and the way to do it is to utilize your team. So when you can delegate as many of these things out to your team, the better off it's going to be. So using that situation of how we had the attachments popping off, in the beginning, I was the one troubleshooting all of this stuff. I was holding my team's hand. I was the one figuring out which attachments it was. I was the one ordering it. But honestly, most of that stuff can be delegated out to your team once you know what you're doing. And so once we really got going with cases, my team could diagnose which attachment fell off. They had access to my portal portal to be able to go in and actually order the replacement tray. They would place the attachments on, and then they would grab me at the end to just check and make sure that everything was done correctly. This is a complete game changer because I was able to do other things because I delegated and empowered my team to be able to do this. So if you really want to crank out as many cases as you can and be as profitable as possible, you need to follow the 6 in, 6 out protocol. As a general dentist, you should not be taking on extremely complex cases. Those should be reserved for the orthodontist because they have specialized in doing so. But if you focus on simple and predictable cases and you get your patients in and out in 6 to 8 months, everybody's going to be much happier for a variety of reasons. When I first started, I got lucky and I was only taking on extremely simple cases. So a lot of my cases were done within 6 to 8 months. This left my patients feeling extremely happy and motivated to not only do the procedure, but when they were done, they were then talking about it with all of their family and friends on how great of an experience it was. This in turn helped me get more cases started because there was a positive association with the treatment. Now, if you don't follow the 6 in, 6 out protocol and you do take on big cases that take a lot of time and need a lot of extra trays, you're going to have pretty upset patients. Not only are they going to be upset because of the time that it's taking, but also because of the fact that they have to wear plastic on their teeth for over a year. Nobody in their right mind is actually enjoying that process. So you need to do as much as you can on the front end to select the right cases so that you are only taking on cases that can be done in 6 to 8 months. So I hope you found this valuable, and I wanted to let you know that I am the founder of Clear Aligner Advisor, which is a clear aligner education platform, and we have successfully helped over 150 dentists integrate aligners into their practice who have gone on to generate over $9 million in revenue from aligners alone. We help docs through one of our 2 paid training programs, Aligner Blueprint, which is our core curriculum online program, as well as Aligner Launchpad, which is our comprehensive program with unparalleled levels of support while starting and growing your practice with aligners. This is Dr. Earl. These are his numbers. He had no experience with aligners and then went on to average 9 cases a quarter. And he said, what I thought was a slow start turned into a sustainable procedure that I enjoy providing for my patients. My only regret is I wish I learned this earlier in my career. So all of the course details and information are at this website right here, clearalineradvisor.co. We also have a couple free training programs on there that you will see. You can dive into those if you're not ready to invest in your aligner education to level up your career. Thank you guys. I hope you enjoyed all these pearls. And if you're not already, go ahead and follow me on Instagram or subscribe to the YouTube channel. You can go ahead and just pull out your phone, scan that QR code. It'll take you straight to the Instagram page. And on top of all this, I am the leading aligner educator on social media. I make a bunch of free content that can help you guys start with aligners. So if you want to go deeper on this topic of aligner profitability, I made this video just for you. You're going to want to go check it out right now. I'll see you in there.